Welcome, everyone. And I'm so very excited. I cannot believe the robust student response we were able to get here. I'm Renee Dversdal. I am an internal medicine trained hospitalist and proceduralist. I love POCUS and simulation and ultrasound, all those things. And I've been with Vave as a chief medical officer for 4 years now. In my university and my Vave jobs, I have been involved in kind of pitching faculty, pitching deans, trying to get more POCUS into curricula and into schools. As you know, or maybe you don't know, it's actually not required. The LCME doesn't require that we have POCUS in the curricula. And at my university, I was on the curriculum committee trying to pitch for more time. Now I'm on the industry side of things, trying to pitch for more involvement. And I just thought, let's let deans and faculty and whomever else hear from the students. You all are the ones that we're trying to teach, and we are teaching and to becoming incredible clinicians. So I thought you could share your own take on this.
My name's Agnes Lovell. I am a brand new, as of last week, graduate from the University of Washington's PA program. Prior to PA school, I was actually a vascular sonographer for 8 years. So I did diagnostic ultrasound for a first career, and then now I'm going to be a PA. And I'm excited to be here. I don't know what I'm going to do next. We'll see.
Hi there, my name is Katrina. I'm a second year medical student at Touro University in Nevada, and I'm interested in the field of obstetrics and gynecology. So OB-GYN is what I'm interested at this time.
In which class or year are you in?
I'm a second year, so I'm in the DO 27 class.
Perfect. So preclinical. My goal was to have a mixture of preclinical and clinical, and of course, we already heard grads. So next on my screen is Rand, and I just want to give you a special shout out for making it on your surgery rotation, making it to share your time with us. So thank you.
Oh, absolutely. Thanks for the shout out. That's sweet. I'm Rand Kaller. I'm an MD 26 at OHSU. So that means I just recently started my third year and I've been doing some rotations. And I preceded med school by being a nurse for 7 years. So I got to see ultrasound being used in the ICU to place lines. And then in my rotations, I've gotten to see it by anesthesia used to place blocks, and just the incredible use of ultrasound that in all of medicine has been really awesome.
Hi, my name is Michelle. I am a third year medical student at Touro, and previously last year I did lead the ultrasound interest group at Touro. Prior to that, I was actually in software engineering, and so exploration of new technologies and applications to human health were of very high interest to me.
Very cool. And I forgot, Rand and then Michelle, I just want to give you a shout out. So if you know what you're interested in, especially we'll pitch program directors for your involvement here, but if you're not sure yet, that's totally cool too.
I'm very interested in radiology, so all these forms of imaging are very, very pertinent to my future career.
Me
Cool.
too. I think I
Okay,
might
yeah.
be interested in radiology or critical care, maybe even emergency medicine.
Hi, everyone. I'm Stone. I'm a third year medical student at Touro University, Nevada, class of DO 2026. I'm currently on my inpatient internal medicine rotation, just started it. I'm pretty much thinking at this point, I'm in between emergency medicine and internal medicine, but probably leaning more towards internal medicine at this time, maybe just influencing the back of the rotation that I just had. But that's what I'm thinking right now. And yeah, I've interested in ultrasound just because prior to medical school, I worked with some emergency medicine physicians that were working with POCUS in the ED. So I got to see its utility there, and kind of developed a passion just for learning about it, and continued that passion in medical school.
Hello, everyone. I'm Bahar Masoudian. I'm a second year medical student at Touro, California. It's a DO class of 2027. Prior to joining medical school, I had exposure to ultrasound as a pre-medical student. I worked for a cardiologist for 2 years who taught me how to do echoes. So I'm quite biased towards cardiac ultrasounds. As far as interest specialty, very different, but very related. I'm interested in either doing CT surgery integrated or cardiology, which means I have to go IM and then do a subspecialty. But we'll see where that takes me.
Okay, so Patrick, you are last but not least, and I met Patrick a couple weeks ago at Touro University, California, when you were helping, and I believe Bahar, you were as well, helping teach sessions to the Touro students. And I learned about a cool fellowship that you're doing. So I was hoping you could introduce yourself and tell us more about that because I hadn't, it was unique to me. So I thought it'd be cool for people to hear about it.
Thank you. Yeah, my name's Patrick. I am a fifth year medical student slash junior faculty member at Touro University, California. I'm currently applying for residency this upcoming match. I'll be applying rural full spectrum family medicine. I am in I'm a part of a program at Touro University, California, that adds an additional year to medical school where between your fourth and fifth year, you are a junior faculty member and teach within the Department of Clinical Sciences. Part of that in that department is where our ultrasound or POCUS curriculum lays. And so I'm actively engaged in teaching all parts of POCUS and ultrasound, and that's kind of where my experience came from. I do have 2 years of clinical experience during rotations where at the hospital systems that I was engaged with, they encouraged the use of ultrasound for the medical students and residents, and so I have that experience as well. Learning ultrasound can be quite intimidating and difficult in the beginning as you start to develop your spatial your psychomotor skills and spatial awareness of your hand on the body, and so that can be a challenge. But as soon as you get comfortable with the probe, I think that your ability to apply what you may have learned in the cadaver lab or may have learned in the textbook really is showcased. And then, kind of going through the clinical portion and being able to, use it on a lot of different rotations, and now teaching it, I think it's really interesting to see, uh, you know, um, how quickly you're able to pick it up and how quickly you're able to actually apply the knowledge that you already know. I see students who are really frustrated with ultrasound, who get a little practice in and then are able to recall, anatomical relationships within the body and really apply what they're learning in their other courses. And I think long-term outcome wise, that will only be extremely beneficial to those students who, have that additional memory related to the knowledge. So I think it's really good. We're fortunate at Touro University, California, to have an integrated POCUS curriculum throughout the preclinical years, and it's awesome to see the students become quite well versed with the use of the probe.
So we have two preclinical students, so Katrina and Bahar. I was curious if either of you would mind commenting. Have you had any sessions where you scanned and something made more sense than before, or you maybe saw something in the ultrasound and went back to the cadaver lab? I'm just curious because I like to tell people like we're trying to use ultrasound as a very useful clinical skill, right? But we're trying to take ultrasound to kind of bring the foundational or the basic sciences to life.
Yeah, I can speak on that a little bit. Today we actually had an ultrasound clinic today at school, so that was like really exciting, and it was kind of like a basics intro. What was really cool is we got to work with the standardized patients, kind of even just really learning about like how do you speak to them, how do you say, is it okay, if I have my gloves on, can I touch you? Can I, this gel, the ultrasound gel is gonna be a little cold. Just kind of like talking them through, was telling them there's gonna be like a little bit of pressure here. I'm looking at this. So that was kind of a cool experience, just getting to know how to even like communicate with the patient and how to, use your hands to get that exam started. And then it was kind of interesting that we got some guided help with, let's find the liver, let's find maybe the kidneys, like try this way, try that way. So it's kind of interesting and very, very nice to be able to use your iPad or your phone to have a nice big screen. A couple of us are looking at it. We had like an attending or someone come over and kind of be like, yeah, you guys are looking at the outline of like, there's the kidney, you can see it right there. And kind of outlining just like what it should be. We were able to take photos on it. And, at first it's a little overwhelming because you're like, wow, it all kind of looks like a bunch of squiggles and lines and I'm not sure. But when someone also points it out to you, you're like, oh, I actually see the outline of the liver there. That's nice. And so that was a really cool experience. But I can definitely talk on just beginning to use ultrasound because I haven't had that much experience. I scribed before in OB-GYN and in neurology and ophthalmology. So I saw a little bit of ultrasound, obviously in OB/GYN, but not so much in those other fields. So this is definitely like a really good intro with ultrasound that we've had so far with the Vaves and at school. So I can definitely speak on like that newness of not really knowing where to start, but it's been really exciting and interesting so far.
Awesome. Yeah, sometimes the newness, it's overwhelming. So even like I'll tell mid-career faculty that want to learn, like just you got to jump in, get started, and then it's just reps. You got to practice, 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 practice. And Bahar, I know you've had some reps pre school, so curious about your thoughts on integration.
Yeah, actually, one thing that comes to my mind was during last semester when I was helping out teaching we were doing cardiac renal rest. So it was like integrated, and we had this session with students where I was teaching them specifically just focused cardiac ultrasound. It wasn't like a full protocol echo, but we were just focusing on rolling out certain pathophysiologies. And it was very interesting how much of what they read or watch on videos nowadays or during lectures, and then they can hear it and see it. Like for example, just simply like putting a color Doppler or just doing a CW on a valve, and then show the student that this is what my mitral valve sounds like, and this is what an aortic valve sounds like, and this is what it sounds like if there's a regurgitation, and be able to amplify that. And the student can see it and then be able to correlate that. Okay, so now if you have backflow, what kind of hypertrophy do you expect to see? If you have stenosis, what kind of hypertrophy do you expect to see? And to be able to correlate all the pathophysiology with just like simple anatomy while the student has their hand on the probe. It was actually quite rewarding because a lot of the students were like, oh, wow. Like it was just like their eyes were just like so fascinated by the technology. And although it may be intimidating at first, but a lot of them, like by the end of the session, they're quite comfortable with just finding like the basic landmarks.
For sure. And Agnes, curious from you. So PA school is obviously different than so we've got our MD and DO students here. When you were going through any thoughts or reflections from you coming as a fully trained vascular sonographer into anatomy and other things, recalling it kind of almost like backwards versus forwards? I don't know.
Being trained, so when I went to sonography school, I learned general, which would include abdomen, some echo, but then I worked in vascular.
Okay.
So it made I'll be honest, anatomy is a piece of cake for me. Like, because as you guys know, when you do POCUS, you can just visualize everything in 3D, like within somebody when you scan them. But what's been a challenge for me has been stepping back from trying to take beautiful pictures that a vascular surgeon or a radiologist is going to read to just getting the like what I need to know in a point of care ultrasound exam. So that's been one thing. And then with my classmates, I guess I would say this is almost a teaching perspective because I've got to see my classmates learn POCUS and like what everybody else has mentioned, just how you can connect clinical anatomy to what you're seeing on ultrasound, to what you read in a textbook or what you watched on a YouTube video. I guess an example when Bahar mentioned echoes was like the idea of doing like with our heart sounds, and you're like, oh, and like which spaces are you listening to? And then when you do an ultrasound and you realize like how the heart is rotated in the chest and not like in a textbook, that the difference that makes of understanding heart sounds and understanding the whole like connection between everything. So yeah, I just think it makes learning so much easier. It makes it like come to life for sure.
I love it. How about Rand and Michelle, both of you were USIG leaders as as preclinical students. So what what kind of inspired you, or are there any specific can you and any scenarios or anything where you were like, I'm so glad we were able to do this session with this organ. Sorry, I'm leading the jury too much.
I wanted to do it because I'm a tremendous anatomy nerd, and ultrasound seemed like the most accessible imaging way to sort of get into radiology. And I still view it as such an accessible imaging manner of doing this. So I enjoyed that we could learn anatomy this way and teach each other this way. And it also sort of reinforces the idea of normal anatomical variance when we're scanning on other healthy people. And just like it has been all earlier said, the idea of pulling it out of the textbook into the reality. Um, and it's kind of been an interesting transition from doing this in the preclinical phase where it's like, oh, yay, cool anatomy structures. And then now, as a clinical learner, I kind of see it as an extension of the physical exam. It's like extending the reach of that. Because as much as I love all of the other areas of radiology, and I do, you send someone, you wait, you get an image, you wait, you get an interpretation. Meanwhile, like with ultrasound, you can use it to make these sort of real-time decisions and correlate it very directly with physical exam. One of my favorite ultrasound things to do is, for example, the shoulder, where you have all these physical landmarks that you already know about, these tests that are very helpful for very specifically honing in on different cuff pathology. And then you can use an ultrasound to confirm that, to evaluate that, to see if there's more than just the obvious one there. And it sort of extends that reach so you can have that feedback in real time and be able to give someone some info. Um, One thing that I'm also looking forward to doing with it, which is also very cool, is the pediatric radiologists at OHSU. They will do fetal scans with mothers or parents who are carrying their child, and they'll look at them in real time. They will do that scan, and then they will do the consult right afterwards. And the ability to do that is very cool. And I just want to expand people's reach and interest in ultrasound in my class to be able to have people that would want to go that direction with their career.
Wonderful. How about you,
Yeah,
Michelle?
to rebound on the idea of taking a two-dimensional image, which is what we learned from initially, right? You see like, oh, this is a picture of a heart. Nice. It has valves and stuff. And then you take it into the anatomy lab, like the cadaver lab, and you say, okay, wow, it has a 3D structure, but it's not moving, right? And so now you take it into the ultrasound part where you add like almost a fourth dimension, if you will, because now there is time involved, right? And now this heart is moving in real time. And now you can identify all these different valves and pumping and motion and breathing and all these things that kind of opens up like a whole new page into interpreting anatomy, right? And then you also get really familiar with thinking about these structures, these familiar structures in different planes, right? How often do we think about the heart in an axial view before we do an ultrasound on it? Probably almost never, right? And so I think that is initially a barrier for students to get that 3D image in their head of what's going on. But after they learn to interpret it, it clicks for them and they start enjoying like, wow, there is so much to enjoy in like learning about different body habiti, learning about different pathologies, looking at the way different systems interact with each other and stuff like that is all pretty exciting.
I love it. Stone, Patrick, any other thoughts on that one, or shall I?
Yeah, so I mean, I can just everything that's been said, I think I agree with, and it's all phenomenal. For me, I've really enjoyed just having it on my own to practice on my partner at home or on friends that are also in medical school. There is a little bit of a barrier to learning ultrasound in the very beginning, and I think learning the confidence of the probe and moving it and understanding the anatomy is something that just having a personal probe here is really beneficial because you can practice in a setting that you don't necessarily feel like you need to necessarily perform if you're on clerkship rotations, and you can really learn and kind of be vulnerable with your friends. Um, and I've really enjoyed that. And then just in terms of ultrasound itself, I think that the reason I love it is because you can see pathology in real time. And there's like a lot of people have said there's no delay really in terms of reads, and it's right then and there. And you can go back to it, and obviously it's still going to be there. And so that's one thing that I really enjoy, and I also really love its application to procedures. If you're doing like a liver biopsy or whatever you're doing, that's really critical, obviously. And it's just so paramount and important in today's world. So to get students on board with learning ultrasound in the beginning is only going to be beneficial for patients in the long run.
I love it. And so Patrick, the first year students at Touro University, California. So sorry, Bahar. This is always a little bit contested. The first year of a rollout is always very hard because other students are like, yo, where's my probe? But so the first year students at Touro University, California, every student is getting a device. And then at Touro University, Nevada, now we're on all 4 years have them. We're going on about 4 years there. So I sent one for you to play with, Patrick, and I just was curious if you have any thoughts about, again, that ability to do it on your own time when you have 10 minutes, not within a lab in a scheduled 1 hour. I'm curious if you've been able to play around and had any benefit or learnings with that demo, that loaner.
Yeah, and full disclosure, I have no, conflicts of interest. This is just,
Yes, I should have specified. These students are all volunteer, no conflicts of interest.
um,
I promised we're not sales. We're just
yeah.
talking.
And I just wanted
Thank
to
you.
preface with that because I do think, I've played with a lot of the point of care or portable ultrasound instruments, and my own personal experience is that the Vave probe actually produces, in my opinion, one of the better quality images, and so that has been really nice. I know a big issue with, other portable ultrasound devices is, the picture might be too granular, and there's no detail, and it's really hard to get a good image. So that's the one thing I can say about using the Vave ultrasound probe. The other thing is, the more I play with the ultrasound probe, the more I realize like what other implications that learning ultrasound has. In terms of students who are going on clerkships, I always think about how learning the spatial awareness of using an ultrasound probe translates into driving a laparoscopic camera, and it's actually the same exact process, learning that separation of having your hand on the body and looking at a screen, and knowing where you are spatially. And so I think, the more I use ultrasound, the more I'm able to appreciate the things that it's made easier throughout my medical education, which is always nice with how busy students are. And so, I think having the portable probe at home, it'd be interesting to look at those students who have them at home. Are they more adept at, uh, learning procedures quicker, being able to use the laparoscopic instruments quicker, like what other facets in medicine having this at your hands, really has. And so I do think there's, both the educational perspective as well as kind of this hidden clinical perspective that you gain from having these tools. And so, yeah, I also want to echo what everybody else says. I think it's a good tool to have in your pocket. And I know just one last thought, questions for me that came up when thinking about how do I teach people ultrasound, how do I use ultrasound as a physician, or as a future physician. Originally I was like, well, we have other healthcare professionals and we need to rely on them, and they're on our team, the sonographers, and really moving away from that kind of idea of that ultrasound is only used for diagnostics and more as a tool, like someone else said, within the physical exam. And so that's the only additional thing I would add, is that I think that's important to think about, is it's not only diagnostic, but can also be used in your physical exam.
So would welcome anyone else's thoughts about having your own personal versus like a cohort. Obviously it's money and things are expensive, and we all know tuitions are too high, etc. So there's always this question about like why would we go one-to-one? Why would we do that? So Stone, it was cool to hear your take on that. I'm not sure if anyone else has any other thoughts, and there's pros and cons to everything. But just just curious.
I know finances are always a concern. I know that for OHSU, our sim lab also runs at a tremendous cost, but the difference is fewer learners in there at a time and in a select area, and oftentimes those who self-select into doing it. However, anatomy is often an area that a lot of med students struggle a great deal with, and having this device available for everybody and for people who wouldn't even know or think to seek it out, but then could learn and gain a passion for it and also work with it to facilitate developing those anatomy skills, developing those diagnostic and those physical exam skills on their own time. I think it could really benefit and catch those who are struggling with that as well.
Just one thing I
Go
wanted
ahead.
to add myself was that I think, I'm really into education and teaching students. It's another passion of mine. And I think that there's a little bit of conflation in the literature right now about the role of visualization and sort of imagery in learning. But that being said, one experience for me was that prior to my start of my M2 year, I was learning about pericardial effusions and sort of pleural effusions and all that good stuff with physicians. And I hadn't even learned about it yet in medical school. And I was talking to a resident about it, and he was teaching it to me through doing ultrasound. And I still rely on that memory today, working with him and visualizing that through the ultrasound. And I think, as we all can relate, experiences in the hospital working with patients or seeing cases or whatever is going to help so much more in terms of remembering things. A lot of information in medicine can appear frankly random in my opinion when you're learning it. And so for me, any opportunity where you can really visualize the anatomy, and still today, if I think about a pericardial effusion or things of this nature, I can visualize the heart in ultrasound, and that really helps me remember what's going on. So in that way, it's been immensely helpful for me.
I had a lot of input on this actually, because the fact that the Vave ultrasound or other handheld ultrasounds are super portable with very few plugs, cables, and all that makes it a bit easier to start using it clinically, right? It kind of reduces the barriers to using an ultrasound device because you don't have to roll in a huge machine that you have to plug into the wall and then fiddle around with the buttons because you're kind of unfamiliar with this type of machine, right? And so with all those barriers removed, it actually becomes a lot quicker to maybe influence the clinical management on somebody. So for example, if someone had an like a appendicitis and you happen to catch it on your handheld ultrasound, you might have caught it a lot faster than waiting for that CT, than waiting for the ultrasound tech to come in and do the exam, right? And what is time but money? So maybe it does cost a lot to give students each their own handheld ultrasounds, but you're also saving so much time administratively. You're saving on all that sunk cost and opportunity cost of like having better turnover times on your patients too. And so in the larger sense, I think it is a huge benefit.
Just curious if there's any times where you've been able to like catch something or kind of try to differentiate yourself from your other fellow students.
I'll go backwards a little bit just because I kind of wanted to comment on the ability of having your own probe I'll go back to like the nuts and bolts of when we're learning the physical aspect of clinical work is that, before our surgery rotations, we practice suturing and we practice tying knots and we practice physical exams. Is that if you have a probe that you can practice with, you can practice like that motion that Patrick was talking about of like how hard it is to turn exactly like from coronal to sagittal to long and like rotating around a person's body to like find that 3D view between the ribs to see the IVC or like whatever you're doing. And so just that opportunity of time to scan yourself and practice moving a probe in different directions and like pointing little tiny movements and how now all of a sudden you can see the spleen and you couldn't see it before. And like just all of that is so valuable, and it won't happen if you're, it will happen eventually, but it won't happen as quickly if you're going to like an ultrasound lab or you're sharing equipment with other students, because only so many people can have their hand on the probe at once. And it's usually one person and maybe the person teaching them. So and then people can watch, but it's just not the same as scanning yourself. So that was my thing. During my clinical rotations, I think what I found to be the most like exciting for myself was, I think Stone mentioned it, like for procedural guidance, like I definitely felt by having a strong sense of ultrasound and how to scan, it helped me with like my IR rotation, right? So obviously like doing liver biopsies, placing ports, like IJ access. It was just so much, like I felt more confident and more ready to do all of those things. And then in like family medicine, any of the like hip, knee, shoulder injections, all of that stuff was really helpful to be able to scan and see the needle and know you're accessing where you should be accessing.
There was one time where I was working in the ER and we had a guy come in with like really vague hand pain, and they were thinking maybe it's tenosynovitis or overuse or Dupuytren's contracture or something like that. But in order to kind of show the patient what was going on, I grabbed like a water basin and filled it with warm water because his hand hurt. I'm not going to go put the ultrasound directly on his hand, right? But we also didn't have any ultrasound gel for some reason. And so I used the water as kind of like the window to go look at his hand and kind of hover the device over his hand so it's not exactly touching it. And it was really elucidating and almost satisfying for the patient to understand, like, oh, that local collection of fluid right there in your tendon, that's what's causing your pain. I think when patients are able to see, like, oh, that's where my issue is, or that is what's causing me issues, it's actually really rewarding for them to feel more at ease because they feel more firm in their diagnosis. It's not like, we're not sure, can't tell, we need more testing, right? I think people get a little bit of anxiety from that. And that's also why maybe I'm thinking about the field of radiology is to give people these kinds of confirmation and answers.
The one thing that I think is really powerful that I just wanted to mention about ultrasound is that I think it's really important, obviously, to get it out to the masses because, let's be honest, like how many things do we see on ultrasound that have never been diagnosed, the patient doesn't know about, and they're just kind of incidental findings. And obviously, you can get that in CT imagery or other things as well. But the reality is you can't have the same number of CT scans than you can pocket ultrasounds. And so being able to treat patients in that way is going to, allow for a lot earlier diagnosis on things, or potentially, okay, so we visualize this on ultrasound. Now let's get a little bit more better imagery with MRI or CT, so we can localize it down, and that's going to be really helpful for patients in the future.
I love it for counseling as well. This is all about but I just have had several. You mentioned this, Michelle. And first, I love water baths, super fun. But being able to show people, and then also one example, I encourage you all to remember this one is statins or cholesterol drugs. And patients are like, my numbers are fine. So why do I have to keep taking this drug? I want to be off of drugs. And you can very simply show them the carotid artery with some plaque and like, this is long-standing thing. So the numbers might be fine because of the medicines you're taking. So it's one of my favorite examples. What have you done to try to get more exposure or help get more exposure to your fellow students as well?
Yes, so we transitioned over the mid part of last semester, and last semester we did a workshop like focused only on certain modalities. So it was actually, I didn't know we can do ultrasound with the eye. It's really cool. I had no idea that was a thing, but it is a thing. I still have like a pile of small little baby towels here that that they're waiting to be used again. That was when we did MSK, and then we did a cardiac one, and then we also did a vascular one specifically for vascular access. And then this semester, I'm the president of the ultrasound club, so we already have like monthly, they're called gel rounds, workshops, various names to them, but they're focused on a specific case-based learning type of session. So we'll kind of partner with our sim lab. So we run an entire case of like an acute presentation, whether it be a diagnostic or something that's procedural. And that's how, and then it's also like requires a lot of collaborations. For example, for the vascular access, we're collaborating with the PM&R and anesthesia club. We're also going to do one with like a cardiogenic shock where you need to do like bedside ultrasound to look at the IVC, look at the cardiac function, look at the LV function. And we're doing that in collaboration with the cardiology club. So not only it has created like an opportunity for students from different interest groups to come together and work on a acute presentation, but it also like exposes those that have never had exposure. But again, we're fortunate because we do have ultrasound in our curriculum. It's just for us, it's more of it at an introductory level. It's not really at a diagnostic or procedural level. So that's when, like, as the clubs, we come into place and we add that additional layer of learning for the medical students.
Katrina, would you want to tell folks about your most recent one? And then I'd love to hear from Rand, Michelle, about kind of your favorite, and Agnes, if you did anything as well, actually anyone, but Katrina would love to hear about the OB ultrasound clinic you did.
Yeah, so I'm the president of the OB-GYN interest group at Touro, Nevada. And one event, I think they've put it on before in the past, and I just the old president told me you definitely should do this again. It was a really great success with like the students and the faculty. And what we usually do is we have students come in and sign up for a ultrasound and pregnancy workshop that's led with one of our faculty and the advisor of the club. And what happens is we have two, like this year we had two pregnant patients, and they work for our school. They're like the standardized patients, and they were really like generous to volunteer their time and their, and their stomach for the scan and stuff like that. So that was like really cool that we had a professor and a OB-GYN. He got to show us exactly what we're looking for. They gave a little presentation on that. And then I also encouraged the students, if they had the probes, like their handheld, like Vave probes, to come and bring them and practice using them. So for a lot of us second year students, that was our first time ever using the handheld ultrasound. So that was a really cool experience. So it kind of got us ready, like, okay, this is our first time using it. How do we do this? And I thought it was like really exciting because we had like about like 40 students come out to this event, and it was in partnership with the ultrasound club as well. And they just got a scan, and they're, again, it was kind of like that excitement of like, we don't really know what we're doing, but this is so cool. And having someone lead it and guide it, having a physician be like, yeah, like you're looking, oh, that's the hand, that's the head. Okay, now you found the heart. Do you see that flicker? And then, everyone in the room is like, oh my gosh, that's the heart, and everyone's all excited. And just, I think seeing people being able to connect, like obviously we've learned about pregnancy, we've learned about the reproductive system, we've learned about maybe like even things about, the field of OBGYN, but then actually being able to like have a pregnant patient, scan them, see the heartbeat of the fetus, like that's just so cool. And, even maybe for that patient, they're like, they feel more connected too to like their baby because they get to see the heartbeat again, and they get to like really engage and interact in that experience. And I was just thinking in my mind, I'm like, this is just such a cool experience that students get to use their ultrasounds, get this experience, tell their, friends and family, like, oh, like I saw the heartbeat, I saw, something else like that, like some really cool parts. And I just thought, wow, like this is awesome. This is like a really non-invasive, ultrasound one is one of those modalities, we obviously can't do like CTs or MRIs unless absolutely necessary on pregnant patients, but this is an imaging modality you can do over and over again that's safe and very accessible for students. So it was a really cool event, and everyone was really happy. And even like today, some of the students, when we were doing our other clinical workshop at school, they were just like, oh, I remember the ultrasound workshop, you guys put together. That was so cool. Like now I feel more comfortable and confident using my probe. So that was like a really cool experience. And I was grateful to be part of that, and grateful to help students, get introduced to the world of using the ultrasound.
Thanks for sharing that. I thought it was a really cool, unique way to kind of partner. And yeah, it's awesome. Dr. Ori is very active there as your OB mentor. Any other specific examples? Anyone, any smashing success labs or anything they really enjoyed in terms of trying to bring more into?
A fun one we did was I made some phantoms at home. There's really good phantom recipes online if you haven't looked at them yet. And I put, I have a toddler, so I put goldfish crackers inside of the phantom. And then I put other like like a water balloon, right? Like to practice access. And everybody thought that was super fun. Just learning how hard it is to follow a needle on an ultrasound. but B, like scanning a phantom that if you make it opaque, they can't see what's inside of it, and kind of like seeing something on ultrasound and then knowing or not knowing what it looks like in real life was a fun one. So like grapes, goldfish crackers, water balloons, all that good stuff.
It was fun. We have a little fair for all of our interest group clubs every year. And I'm one of the leads of ultrasound and radiology, but radiology booth got to sit next to us. And then I ran the ultrasound booth, and we had a phantom as well that we put together. And it was kind of funny. My radiology group was looking over. They're like, you're the more popular group. What's going on? Because everybody wanted to come do something that they could come do, right? And so we had phantoms that people could scan. And then also, like, we had a couple of probes, but only like a couple of phantoms. And then one person ended up, I was like, well, why don't you, if you don't have a phantom to scan, but you have a probe, you could scan my wrist and we could talk about what's in it. And I pulled up on my iPad what the wrist should look like, and then we identified together. And it was really quite cool. And it's one of our ways of trying to get more people in the club. And I feel like the moment someone actually holds an ultrasound and starts doing that, they recognize the value of it immediately, which is something that I feel having that portability and having the ability to convey that is amazing, especially when you can get really good images to get those sort of detailed pictures. So
Awesome. Go POCUS. Basically, I tell everyone, I'm like, anything you can do hands-on, fun, real time. And sometimes faculty are like, well, I'm not that good. And I'm like, look, students just want to look at stuff, and it doesn't take, like, just look at the heart. It's cool. Like, that's all. You don't have to be an expert. And so I think this is where the learners have caught up and surpassed the expertise of many faculty, and that can be scary. And so encouraging, and we try to do train the trainer where we go. That's how I met Patrick and saw Bahar and the team there. So train the trainer, get the faculty trained up, and then near peer teaching is huge. And Patrick, you've got your hand up actually. So yeah, let's hear.
Yeah, I just wanted to say, that that is also something that I hear a lot about is people who might not who trained in a period where ultrasound or these technologies might not have been as accessible, are less confident in their skills. And so this is a great tool for at least our university. We, like you said, use that near peer or peer model for teaching. And so this gives our students students like Bahar who are in the ultrasound club, an opportunity to actually provide that education to other students who aren't as engaged in the ultrasound curriculum. And so it does offer that, and I find that students are actually very motivated and very technologically advanced. And so they pick up these skills quickly. And so if, for potential schools who may be worried about, what faculty would be their core faculty for teaching an ultrasound curriculum is, engage the students will pick it up so quickly. It's amazing. And then I just wanted to highlight, from my clinical years, where I trained, there was always ultrasound available, and we would do fluid assessments on all of our heart failure patients, and after using it in the preclinical years, that it just felt routine. It felt way easier than checking someone's JVD. That's for sure. I'm sure you can appreciate that as a hospitalist. And then I did some work on a trauma service, and fast scans were quick and simple, and I could get those done while people were still doing their primary survey if the patient was hypotensive, and I think it just, you don't appreciate the skills you develop in the preclinical years with ultrasound until you're in a clinical situation where that changes what your next step is, or how you're going to treat the patient. So I think there's a lot of value in it. That's for sure.
Yeah, I just had a couple of thoughts not necessarily related to, like, from a student perspective, and this doesn't need to be on the recording. It's really up to you, but it's just based on my interactions and some of the feedback that I received from the faculty. So as Patrick was mentioning, we have faculty that perhaps did their bulk of their medical training and spent their career during the time that ultrasound wasn't really a thing like it is today. I mean, when I was a scribe, I worked in inpatient and outpatient, and I was on medicine and cardiology service. And I mean, in the objective part of the physical exam, there was a template. There was like a dot phrase for POCUS specifically. And like Patrick mentioned, I mean, IVC, the IVC was something that every new admission in the ED, you would just put the probe on it and look at the IVC to look at their volume status. I don't ever think the cardiologists I work with, even like carried a stethoscope, it was probably to teach me how to listen to sounds. He never really used it. Never really saw him with a paper and a ruler measuring JVD of a patient that was admitted and was on GDMT. But and I mean, aside from the clinical aspect of it, I think in terms of implementing it specifically in preclinical curriculum, aside from cost, what I think is also like buy-in from faculty that are in a position of decision making. And I think really reiterate that this is not meant to replace a history and a physical exam, but it's really to augment whatever your diagnosis or your working or differential diagnosis is, or to help you like maybe come up with a decision. Because oftentimes I hear that from the faculty that are not really for ultrasound, is that they think it's creating a complacency and sort of a lazy mindset for medical students and residents to directly grab the probe and put it on the patient instead of reverting to some of those traditional historical physical findings, where again, I mean, they're still tested to this day and we're trained on it. But if there's a more efficient and maybe a more sensitive, more specific way of doing that same thing, then why not? So I think maybe approaching the faculty from that perspective would also help maybe being able to implement that individual probe for every student.
If any of you, I'm sure some of you have read the POCUS manifesto, and they talk about how that basically POCUS is like this century's stethoscope. And when I think about schools that are like, including my school, like dragging their feet about implementing POCUS, is 100 years from now, it's going to be like everybody's using POCUS. And if you're not, like, what were you doing? And I truly firmly believe that. And so I just think that if you think back on when stethoscopes were new, there were people who were like, well, I'm not going to use that dang thing. I have my rolled up piece of paper or whatever they were using. And that's kind of like where we are now with moving into using POCUS for a lot of things. That's my opinion on that.
Did an ultrasound curriculum have any say or any input for you in selection of your medical school?
I could just say quickly, I think what you just said definitely is true for me. I knew that they had ultrasound here, or they were at least the dean was trying to engage in making the educational experience for students more diverse in regards to ultrasound here. So yeah, absolutely. That was the case for me. And I think that it's just one of those skills that, like, I can't reiterate enough, like everyone should know how to use it. It's so applicable in every, like, in, I don't want to say every setting, because I definitely don't have experience in every setting of medicine, but in a lot of settings, right? And so yeah, I think it's just absolutely critical. And for me too, like, to be able to gain confidence just with it, using it on my partner or my mother, or who, just for fun, just to see around, has been so beneficial.
Ultrasound didn't factor into me choosing the medical school. OHSU doesn't have a ton of ultrasound curriculum at the moment, but it definitely is part of my elective selection right now, and it will be part of my radiology selection as far as my residency, because I want a robust and procedural radiology residency. And so if I'm going to have that, oftentimes that goes hand in hand with having a lot of hands-on ultrasound time. So that's something that I think everybody, as we continue to see it as the modern day stethoscope, as was so aptly characterized by you and Agnes, I think that that's something that a lot of people will be looking for to want to keep their medical education at the highest and most modern level.
I can add, as I'm actively applying to residency and soon to submit my application in the next month or so, I think that is one thanks. Um, thing that I'm evaluating. I'm interested in working in very rural, resource limited settings, and so having something that I can carry around in my pocket in a setting where I might not have a MRI to like look at some soft tissue for MSK injuries, or maybe I need to make a decision on my feet and don't have time for the patient to go back to the CT scanner. Um, I think it'll be critical that I have at least the experience and somewhat of the knowledge to use that in my tool belt. And so for me, it does play a factor in how I rank or look at applying to various programs.
I had no idea about my curriculum having ultrasound, so I didn't know it was a thing. But I mean, I'm also very fortunate that we do have it in our curriculum, so it was not really a factor because I didn't even know it was a factor.
So if you have any words of wisdom for anyone thinking about this or thinking about trying to incorporate it more in their medical education, whatever their program or school is, we just love any words of wisdom. And
I worked in finance for like almost 10 years, actually to be exact, 9 years and a few months before I decided to join medical school. So I always know it's always about the money, but I'm just kidding. It's like, but I mean, one thing I would challenge medical educators is to partner with people that are in a position of making financial decisions, people that have actually fiscal authority and see. I mean, I always think that an organization can think internally because there are things that are currently not being utilized, but yet there is a fixed cost associated with it that goes on that balance sheet every year. And if they do a really full cost analysis, are there places that you can reroute to get ultrasound? Do you have resources that are not being utilized, but are still kind of like sunking that money, but then reroute that resource to be able to provide that, if that's the financial aspect of it. And if it's really training and buy-in, then there is, I mean, you're a perfect example. There are industry people out there that are willing to get out there and train faculty to be able to train medical students. But I think they have to start from like someplace. It's like, if it's a money issue, try to work with your fiscal authorities in your organization. If it's a lack of training or buy-in issue, then maybe go and look at the people that are doing it and see how much more advanced and prepared their medical graduates are for their career.
I can't speak to the finances. I've never been in finance of any kind. But what I can speak to is the fact that a lot of traditionalists have this very strong feeling about the importance of the physical exam and that the physical exam is in some way dying out. And I would like to say that I've only felt like a better understanding and a more appreciation for the physical exam through my use of ultrasound. And that I really do see it as an extension, a modern extension of the physical exam, not replacing it, but part and parcel to it. And I hope that they can end up seeing it that way too.
I would just like to echo that as an educator myself, teaching people how to examine a thyroid and telling them that I promise you there's a soft tissue gland under your fingers. It was quite challenging until I could actually show them, that they're doing the appropriate physical exam with the ultrasound probe, that here is the thyroid. And so just to echo that, and another thought is, I would say, for all the surgeon medical educators out there, I think it's very similar to this, as people transition from laparoscopic procedures to robotic procedures, I think we're in a very similar transition point where we're still trying to define at what points we should use POCUS and where it's better than a physical exam or where it might not be better. But if you talk to any surgeon, the trend is that more and more things are becoming robotic, and I think you'll also see that same trend with ultrasound compared to the physical exam.
I think that I would tell those that are, deciding, should we implement ultrasound, should we not? Is it a good idea? I think overall, medical students and those, training in the medical field, they're tired. They've been taking all these tests, studying their books, especially when you're first, like, kind of didactic years. And I think if you have the opportunity to give them some kind of handheld, like, here is your ultrasound in your hand, and you get excited about it and you get to scan someone and really learn something like right there. I think if you have that ability to not only get the students excited, get them hands-on, get them learning something new, but then also you're just going to prepare, better medical professionals in the field if they know how to use, any kind of technology, but especially ultrasounds that give you that like hands-on, like in the moment, learning. So I think I would definitely recommend that if you can get us something that'll get us excited and get us involved and get us interacting with the patient and seeing things, in real time, that I would really recommend it because I think it's going to go a long way for students and, for everyone involved, patients and just healthcare in general.
You've all been amazing. This is so super helpful. Just hearing it in your own words and in your own ways, I think is incredibly helpful. Cool to hear the kind of some of the different backgrounds and interests. Super cool to have two radiology folks. And we've got, thank you, Agnes. I was hoping to have a PA. There was a PA student from Touro who was maybe going to join but couldn't make it. So I'm happy to have our DO, MD, PA. We didn't get any NPs, but I like to try to give everybody, I think all of our students should be like pluripotent POCUS stem cells, and everyone should have this foundational knowledge to go ahead.